Welcome back to the Poisoning Podcast. I'm your host, Erin DeLulo. Today we're diving into one of the most urgent issues of our time, the failures and false promises of America's rehab system. My guest is Shoshana Walter, investigative journalist and author of Rehab, a powerful new book that exposes the way we treat addiction in this country. We'll talk about the hidden exploitation inside treatment centers, the human stories behind policy failures, and what real solutions could look like. Shoshana, thank you for joining the Poisoning Podcast today.
Thanks so much for having me, Erin. I appreciate it.
Yeah, I got to dive into your book on my plane ride last week, a plane ride without Wi-Fi. So, it was like Providence saying, you're going to read this, Erin. Very rare these days, right? We all don't know what to do with ourselves. But it's fascinating. This whole topic of rehab, I think, this is our third episode on a topic like this because there's just so much to explore. So I want to know what initially drew you into investigating America's rehab industry?
Well, I'm a longtime criminal justice reporter, mostly focused on long-term investigative reporting. And I was a reporter at Reveal from the Center for Investigative Reporting about 8 years ago when I just kind of stumbled across this drug rehab program that courts across Oklahoma and Arkansas were using to send people to in lieu of incarceration. So pretty, traditional, typical diversion court model where, instead of going to jail or prison, people were getting the opportunity to go to treatment. It sounded really great in theory. But when I started looking into this particular program, I learned that it had been founded by a former former poultry industry executive, and that the participants in this long-term program were being sent to work unpaid at for-profit chicken processing plants where they were making chicken products for KFC and Popeyes, Walmart, PetSmart, Rachel Ray Nutrish, a lot of products that pretty much almost every American consumer purchases that were being produced by unpaid rehab participants. And it just came as a total shock to me. I never heard of anything like that before. And it made me want to understand how common that is. And, if in this day and age, unpaid labor could be considered treatment by so many judges and prosecutors and professionals, what does the rest of our treatment landscape look like? And is it working the way that it's supposed to? Is it actually helping people?
And so that was sort of the moment you knew it needed to be a book or that there would be more?
That was the moment I knew that I needed to spend, divert my time looking at this,
Okay.
and I then spent a few years working with colleagues at Reveal, investigating rehab facilities, particularly these rehab facilities that require unpaid labor. And we found that that chicken processing plant place was just the tip of the iceberg, unfortunately. There are facilities like that across the country. And I spent several years reporting on those facilities. And amidst all that is when the seed for this book really began. And I realized there was much more to say about our treatment infrastructure and how it's really not serving people the way you'd hope it would, considering we're in such a massive drug epidemic that has received so much attention. People are really not being served by the system that we have set up.
And did they know they were going to be working at a chicken processing plant? Basically, I don't know. Do we pluck feathers anymore with the hands? There's probably machines for that, but still, it's hard labor. You have to have a hard stomach for that, right?
Yeah, I would say, we interviewed a lot of people who went through this program, and no, I mean,
Mm,
there was one court that referred to this place as the chicken farm, which makes it sound very, very quaint.
Right.
but actually these individuals were working at industrial chicken processing plants, Simmons to be exact. So one of
Mm.
the largest chicken processing companies in the United States. And people were routinely injured in this program, in a way that was detrimental for many of those people. So no, I would say most people wanted this program not knowing exactly what they were stepping into. And then the thing about it being court ordered is, you know, if you leave the program, then it appears as though you did not comply with the court's requirement that you finish it. And so there were enormous consequences for people who failed out of the program, often as a result of being injured in the program. Um, and
And
so
how long would a program like that last? 6 months, a
anywhere
year?
from 6 months to 2 years. So longer term. Yeah.
I mean, to me, prison would probably still be worse, but I was not meant to cut up chickens every day or dismember chickens. Dismember chickens. It's a different thing. I cut up chicken a lot. But wow. What type
Yeah.
of injuries did these folks sustain?
Uh, One individual got a brain injury from a door falling on his head. Another individual had his hand crushed in the
Yeah.
conveyor belt. Um, Another individual sustained burns while cleaning up with the chemicals. I mean, these are like some of the worst jobs in America.
Right.
The injury rates for any, for a poultry processing job are incredible. I mean, it's why chicken plants have a really hard time finding employees. And so I think what these um, rehabs are doing in a way is a bit ingenious because they're filling a labor gap. Um,
Right.
they're filling a labor gap with individuals who have no say over their treatment, their work hours, um, whether they get a sick day. These are individuals who have absolutely no power or control. And this is what courts are saying is their treatment for their addiction, is this exploitative unpaid labor arrangement.
The former poultry executive who created this, was this like, do you think day one he always knew he was like, Eureka, I'm gonna find free workers? Or do you think it was like, well, maybe we can help some folks?
We talked with her when we first reported this story, which was, I want to say 2017.
Wow.
And this was a program that was faith-based as well. So she's a like a
Stop it.
strong Christian.
Mm.
And so I think they genuinely believed that they were doing a good thing. And
Okay.
I could understand why they would think that because again, people who need treatment and help for their addictions often are not able to get it. And so this is the situation that we have in this country of people being desperate for help, and the only way they can get it, the only place they can find it, is in a program that exploits them for unpaid labor. That's the situation that we're in the United States
Mm.
still to this day. Um, so, you know, some treatment might be considered better than none, but when the treatment is exploitative and harmful and um, makes people feel hopeless,
Yeah.
um, in a lot
That's
of
not,
cases, it's not better.
no, that's not recovery. It's gut
Yeah,
wrenching.
sure.
Mm. And you mentioned, shadowing clinics, harm reduction, advocates, and workers, interviewing so many people in recovery. How did those experiences shape the narrative of the book Rehab that you've written?
Yeah. I interviewed hundreds of people.
Yeah.
I mean, I knew when I first started working on the book that I wanted this thread of reporting to be a part of it. These unpaid work programs um, that are really intended for people who need long-term treatment or who don't have the resources to support themselves during treatment. And these programs are often utilized by courts because they rarely cost courts or local governments any money, and
Mm-hmm.
they'll accept people without health insurance. So I knew that needed to be part of the book, that this is a big vein of treatment in the United States, but I didn't necessarily know what else needed to go in the book when I first started reporting on it. I really had to start from the ground up in understanding, what does the treatment landscape look like? What are the problems with our treatment system? And also, what does good treatment look like when it's working properly? And so that was a long process. I mean, I did ride-alongs with the harm reduction van here in Oakland. I live in Oakland, California. Um, I shadowed providers at the Bridge Clinic, which is a treatment clinic at Highland Hospital, which is a safety net hospital here in Oakland. And they treat a lot of unhoused individuals who are in need of addiction treatment and medical care. I shadowed providers in San Francisco, and I interviewed researchers across the country, and really ended up narrowing my focus to three other major threads that I identified through my reporting. Um, one of those threads is focused on our for-profit addiction treatment system that really proliferated in the aftermath of the Affordable Care Act. And I know you
Yeah.
just had Ben Flaherty on
Yeah.
recently, who just produced a whole documentary about this. That's excellent. But that was one vein of my reporting that I really focused on. I then wanted to understand why addiction treatment medications like Suboxone were not as utilized as they could and should be, according to the research. And that became another vein of reporting, looking at how how that medication was rolled out in the United States, why it hasn't kind of lived up to the promise that it once had, and how how our government has treated this medication, particularly the Drug Enforcement Administration, which has treated it with such tremendous suspicion. And then the other vein that I ended up focusing on is the lack of access to treatment, the major barriers to treatment that exist in this country, especially for women of color and mothers in the United States. Over the past few years, we've seen overdose deaths overall start to tick down, but among mothers, overdose deaths have been skyrocketing over the last few
Yeah.
years. And we've known for decades that treatment that allows women to remain with their children have better outcomes for the entire family. And yet, what I found in my reporting is that the number of facilities that actually cater to mothers have declined drastically over the course of the epidemic. Even as millions more people have access to treatment thanks to the Affordable Care Act,
Yeah.
those same benefits have not been seen by mothers. And so literally mothers are dying in the US every day because of a lack of treatment. And so that became another really big piece of the book.
No,
These treatments.
the mothers, well, the mothers and babies and children has
Hmm.
been something we've focused on in the little over a year this Substack and podcast has been running, because they are the forgotten, right? They're, at least when it comes to opioid settlement spending, they are not getting much. Now, I will put an asterisk that Attorney General Tim Griffin just invested $55 million. I don't know if you've seen this, in his opioid settlement money into a program for babies going through withdrawals, so the NAS.
Yeah.
That, and I will, but you don't hear about that in every state, right?
Mhm.
So
Yes.
that's one of the few sort of little bright spots that's happening. But let's dive into, because I think I want to dive into this sort of there's probably several thoughts around the mothers. But
Mhm.
what is the argument for not providing these mothers childcare, or not just allowing them to bring their children into treatment with them?
I mean, ultimately, I think that it comes down to money
Oh.
and how we are choosing to prioritize the limited resources that we have. And I think again and again, we've seen mothers, particularly mothers who use substances, fall to the bottom of that priority list. I think back to how mothers, especially Black mothers, were characterized during the crack cocaine epidemic of the
Sure.
80s and 90s. Um, they were demonized for using substances during their pregnancies. I mean, there was no worse offense in the minds and eyes of the American public than a mother who used drugs during her pregnancy or used drugs while taking care of her children. And so women weren't just, not given treatment or compassion. They were criminalized for this. And during that era is when you really start to see so many more children entering the foster care system and removed from their mothers, removed from their families. I will say, like, during that era, you
Mm-hmm.
still had people really concerned about the lack of treatment for mothers. And so lawmakers even passed guidelines asking states to spend a certain percentage of their treatment funds on treatment specifically for women. But states just never lived up to that promise. And since then, studies after study has shown that treatment that allows women to remain with their children have better outcomes for the entire family, for the babies, for the mothers. About 70% of women struggling with addiction have children. It's one of the top reasons women cite for not going into treatment. And yet, these facilities that cater specifically to mothers have continued to decline dramatically.
Mm-hmm.
Today, only about less than 3% of facilities nationwide allow women to bring their children with them, and less than 5% of facilities offer childcare. So the result of that is that women are being separated from their children. Women are being jailed and incarcerated for using substances. Even when women do find treatment, and it can be hard to find treatment for the reasons we just discussed, and also there's a lot of discrimination against pregnant women in treatment facilities. Even when women do find treatment, they can be punished for using medications like Suboxone and methadone during their pregnancies. And so what is happening is women are incurring all these consequences for something that is treatable. And when they're not able to access help and treatment or support that they need to access help and treatment, then they are overdosing and dying. And it's a really dire situation.
Right. Should it be seen as, I'd rather have a pregnant mother go on MAT, or medically assisted treatment, because that's the better option, even though we'll know the baby will come out with neonatal abstinence syndrome, which I've done a whole podcast episode on that we're going to be releasing soon. Is that better than the loss of life? And I don't understand how people don't come to that conclusion. I know I'm trying, like,
What?
smiling about this, because it's like I would be really just down in the dumps if I thought all of society is like, well, let's just let them die.
Right. I mean, it's it's appalling. And there's really no question about it. You know, every leading public health authority in the nation encourages women to use Suboxone, buprenorphine, methadone during their pregnancies. It leads to better outcomes for them. It leads to better outcomes for their babies. Withdrawal symptoms among babies, it's heartbreaking, but it's also temporary and 100% treatable. And
Right.
what studies have shown is that the best treatment for withdrawal symptoms is actually for the baby to remain with its mother, to have that skin to skin contact, to breastfeed, to have that comfort that they've grown accustomed to. So actually the separation of mother and child, it it hurts the baby rather than actually helping
Mm.
the baby who's struggling with withdrawal symptoms. And then of course, this hurts, all of these things hurt the mother, but it's traumatic for the children who are separated from their family. Um, it's yeah, it's a really a disturbing situation.
And let's then talk about just medically assisted treatment altogether, because we could talk about the poor babies and moms, but we've got a lot to cover. So this is really, I find it to not be as clear cut, right? Medically assisted treatment. In this project that I've been working on, reading your book about how there's not access and how hard it is to get, we'll call MAT, now that we've described what it is. But then, in Ben's documentary, there seems to be abuses in this system where I think that a protocol is being created to put people on it who don't necessarily need it. And it was not the first time I've heard of this just in Shuffle, Ben's film, but I'm hearing it from an opioid commission member in Utah. I'm hearing it from the gentleman who runs one of the treatment centers here in West Virginia, where I'm based. So I think there's a lot of we'll say complexities around MAT right now. And I think it's being sort of withheld from people, but then pushed on people who might not need it for potential profit.
I think we're almost talking about two different things here.
Really?
Yeah.
Okay.
So I think the evidence around MAT is significant. It it can reduce overdose deaths by more than 50%.
Right.
It's it's pivotal, and its use in other countries had massive success in reducing overdose deaths. In the United States, and this is also something that is in my book as well, we have a treatment system that is poorly over there's what we have a treatment system with extremely poor oversight, with a lack of standards of care, and that is extremely profit driven. Particularly the programs that accept insurance payments are
Mm-hmm.
extremely profit driven. And so I saw this, and this is a storyline in my book. I saw people entering detox programs with very little medical oversight. Um, and they were all put on the same detox protocol, this cocktail of extremely powerful medications. Sometimes they were medications that the evidence shows should not be paired together because it can lead to overdose or it can lead to impairment. And that's exactly what happened. There is a program that I focused on in my book in the San Bernardino Mountains,
Yeah.
where people were being over medicated to the point of impairment. Some people received Suboxone who didn't even have a history of opioid
Right.
addiction, who didn't have took a urine test that showed they did not have any substances in their system, and still they received these medications. And what ended up happening is that, and also, sorry, this is a really
Yeah.
important piece of this
No,
book,
it is.
this storyline. some of these individuals received these prescribed medications, even though the record showed they were not actually prescribed to them. And this program had a history of saving old medications, giving them to new patients. Um, I learned that several doctors had 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 I learned that several doctors had their prescription pads used by this program to fill prescriptions that were never actually prescribed or authorized by those doctors. And numerous people died in this program after receiving these powerful cocktails of medications that records showed were not prescribed to them. And still, despite that, despite years of people dying in this program after receiving these medications, the state and local law enforcement did not do anything to shut them down. I mean, the only reason that program shut down is because the owner said that he was in debt after a series of wrongful death lawsuits. So I think we have this really heinous combination of, um, what the literature says, what the science says, and what a lot of rehab programs are actually doing, which is um, doing everything they can to make as much profit as they can, even if the care is not individualized, even if the care is not actually what that patient needs, and even if that care is endangering that patient's life. Um, but I think that it's clear, the evidence is clear that medication assisted treatments like buprenorphine can be life changing. They can be extremely powerful tools for
Hmm.
recovery, but if they're utilized in the wrong ways, it can be devastating.
And that's what I think a lot of people don't understand, that yeah, that people are utilizing them in the wrong ways for profit. And it's just heartbreaking.
Yeah. I mean, even so, in my book, I follow this doctor, Dr. Larry Lay, who was one of the
Hmm.
first film prescribers in the nation. And Dr. Lay passed away a couple of years ago, so he's no longer with us. His program, I describe it in depth in my book. It's not the model program by any means. Dr. Lay was motivated by a number of different interests, including wanting to make a profit, wanting to have a successful business, but also he had himself had a history of addiction. He really wanted to help people, and he saw the huge need, the huge unmet need for treatment in his region of the country. This was a period of time, around 2003, 2004, when the epidemic was really starting to take off.
Yeah.
But it was almost impossible to find a Suboxone prescriber. And prescribers were very limited in what they could do. There was a limit of 30 patients per prescriber, and the strict oversight by the DEA, and providers had to take a specific training and apply for certification to be able to prescribe addiction treatment medication. Never mind the fact that like any provider or prescriber could prescribe something like OxyContin or even Suboxone for
Right.
pain and not be subject to those same patient limitations. And so he was really meeting an unmet need at that time. People were desperate for treatment, and there weren't that many requirements in his program. You paid $40, you went in, you got your prescription, and you left. And that attracted the attention of local law enforcement and the Drug Enforcement Administration, and they actually raided Larry's clinics, arrested him and his entire staff, and shut his clinics down, which cut off hundreds of patients from their medications, prompted many of those patients to relapse because they couldn't find other providers, and some of them even overdosed and died. And eventually, Larry was put on trial, um, and he was acquitted. And the charges against the other providers, the other doctors working there, the parking lot attendant, the nurses, were all dropped. Um, and when I met Larry, he was just, because of this, his life kind of blew apart. I mean, he lost his medical
Oh.
license, he relapsed, and he just wanted someone to hear his story and acknowledge the role he had played in providing treatment during a time when it was really impossible to find that treatment. And so, I was able to read through the entire criminal case file. These are records that are typically totally confidential and off limits to journalists. Um, I read through all those records. I watched hundreds of hours of Drug Enforcement Administration undercover agent footage, so I could actually
Mm.
see what this clinic looked like, what those agents were seeing when they went in there. And what we know now from the research is that um, low barrier treatment is incredibly important. Treatment programs that put up barriers to access, that make it difficult to remain in the program, have worse outcomes. There can be really positive outcomes from doing nothing else but providing a patient with that single medication. It can actually keep that patient alive and facilitate a larger, longer term change. And so that was essentially what Dr. Larry Lay was doing well before that research showed how important and valuable that low barrier treatment access can be. Um, and
So
for this, yeah, sorry, go ahead.
would you describe some of those barriers or what you would consider a barrier that you found to that?
Yeah, I mean, getting prior authorization from insurance companies can take a long time.
Yeah.
Um, okay, people who have Medicaid, who only have Medicaid, and a lot of people in this country may soon not have Medicaid, but people who only have Medicaid can face enormously long wait lists to enter treatment. Um, And then at the time of Larry Lay, and still to this day, it can be very difficult to find a prescriber of Suboxone or buprenorphine or a methadone program um, that is close enough to access on a daily or regular basis. So proximity is a huge barrier as well. Does someone live in a rural place or an urban place? What facilities are even nearby that they can access? Um, and then, of course, um, a residential program is harder. It can be harder to find, but it provides housing. It provides a place to live and sleep and food. If if there is no residential program available to you and you're looking at something like an outpatient program, well, that requires you to have the flexibility in your life to take a break to go to this program. It
Hmm.
requires you to have regular transportation. If you have children, it requires you to have childcare. And so a lot of the barriers to accessing treatment have to do with the conditions in a person's life. If you're childless and you have the money and the transportation and food and housing, you can more easily attend an outpatient program than someone who is living precariously, who doesn't have the financial resources, who has a family that's depending on them. Um, these conditions make it much more difficult for people to access treatment, to enter treatment, to find treatment, and to actually finish treatment and then make use of that treatment once they leave.
It's basically like you're describing someone who already has like a good social community around them, right? Because they already have a job or money to pay for their basic living expenses. When you've been in the grasp of addiction, usually you don't have those things.
That's right.
And
That's
to me, that's like sort of common sense. Especially if you've like been living, you don't have a house, you're living on the streets or in a park or somewhere or in a car, that doesn't make any sense. And Previous guests, one of them specifically brought up the fact that when they help women, they have a program in Vermont that's residential. Some of these women are coming out of sometimes incarceration, and they don't even have a driver's license or their birth certificate to get a a new one, right? To even take the test. So, and
Right.
I know I'm saying I'm laughing about this, but this is like things people don't think about that seem like sort of obvious. If you're in the worst like place in your life, you don't really keep all your documents stored properly.
100%. Exactly right. I mean, this is actually like, I feel like one of the biggest takeaways and surprises for me in working on this
Hmm.
book is I thought I was going to be writing a book about our treatment system, but what I feel like I found is that it's
Yeah.
actually what happens outside of treatment that can be more important for recovery than the treatment itself. You know, it's all of these other aspects that we've been talking about, and it's what researchers often refer to as recovery capital. You
Mm.
know, this mixture of resources, internal, external, that can help someone enter recovery and then sustain recovery. And that can
Mm.
include community, social supports. It also includes housing, financial security, transportation, food, healthcare and medical care. Um, all of these facets are super important for someone trying to enter recovery. And oftentimes, treatment programs are not able to help people access those resources.
With the wraparound
And
services that they need. Yeah.
right.
To
And
be,
the longer, yeah, sorry, go ahead. Yeah.
no, just to re-enter society and get a job and be part of their family or community if they have no children or family around. Like just give the basic resources and help. It's, I think politically, some people say, well, okay, the stigma, they've done something bad. They should just go figure it out. Well, it's like they did something bad that also, altered their mind and was highly unhealthy. We need to help them, not help them, like by just letting them live on the street, but by helping with services.
Yeah.
I don't know. It's not that hard. And, there could be more nonprofits doing it, you know? I mean, I advocate for that. There could be also some, basic local governmental help, but there's lots of ways to solve this.
Yeah, I mean, it's really it's simple, honestly. I mean, the answer is not simple, but if we don't want people to remain stuck in their addictions, then those people need to be able to move beyond their addictions.
Right.
And oftentimes what we see in the United States is that the consequences of addiction can become their own kind of barrier to recovery. Because the longer someone is in addiction, the more punished they are, the more marginalized they are, the more collateral consequences come from that addiction. So that can be, a criminal conviction, that a
Mhm.
criminal conviction can make it very difficult for someone to find a job, for someone to find housing. Um, it can make it impossible to get a loan, to get government benefits and services that other people ordinarily might be able to obtain. It can cut you off from a social network that would, facilitate access to community or to a job or to people who would help you find housing or transportation. So there's all these consequences that come along with addiction that need to be addressed if someone actually wants to make a change in their lives and move on from that addiction. And what's simple is, if we want people to be able to move on from addiction and recover from addiction, then they need to be able to overcome those consequences.
Well said. So let's go back to programs like Semaphore. It's just making me think. Um,
Yes.
Am I saying that right? Senecor. Senecor.
Senecor. Yes,
Senecor.
exactly.
Thank you.
Yeah.
Sorry. With a K is like throwing me in that word. So
Names are always very confusing with treatment programs.
is there any type of punitive punishment, except for in the addiction space, where we put you into forced labor for-profit companies? Did you find that? Did you see that?
Would you mind repeating the
So
question?
Senecor and
Yeah.
the chicken processors and all of this, the forced people into, labor, unpaid labor. Is there any other punishment or crime where you would get that type of punishment? So we know addiction or, having a drug possession or drug use and you are put into the system has led to that in certain places. Did you find any other crime that had that type of punishment that matched that type of punishment?
I think, unpaid labor is a cornerstone of our criminal justice system, our prison system. Since slavery was abolished, prison has been used as a form of labor. Um, but I think what's a little bit different about these programs is that they're not supposed to be a punishment. They're supposed to be getting treatment. Um,
Mm.
and and many of the people in these programs are court ordered there for treatment, but there were also people there in these programs who were there voluntarily. And the reason they were there voluntarily, oftentimes, is because they didn't have insurance. They otherwise wouldn't have access to treatment, and they needed some place to go. I mean, basically, these are places where people can go who don't have the resources they need to actually live and function in recovery in their outside lives. And so it's like a place of last resort for a lot of people. If you need a place to go, this is where you can go. Um, and some of these places are providing treatment. I don't want to say that they're all not providing people with what they need. Even in Senecor, I interviewed people who got something out of this program. Um, they got community. They met other
Okay.
people who were in a similar place in their lives, for example. But what I saw again and again with these programs and what I saw with Senecor is that it can turn into a very exploitative arrangement. And it can create a feeling of powerlessness, of hopelessness, um, of being worthless. And those feelings are detrimental for people who
Oh,
are
sure.
at this stage in their recovery process, for anybody, but especially someone who's kind of been beat down um, by their experience in addiction and are now trying to change. So yeah, I mean, with Senecor, I mean, people were working up to 80 hours per week in really tough manual labor jobs. At one point, the program was sending people to work at Exxon and Shell oil refineries. Um,
How were they skilled enough to do that? No, I mean, I'm not saying that people with addiction issues don't have skills from their previous, training, but it doesn't seem like you would just pick somebody up and say, "Let's put you in this oil refining job."
I mean, some people were in this program who did have this prior
Okay.
experience.
Okay.
Oftentimes, these manual labor jobs are actually where people first developed
Get it.
addictions.
Wow.
So it actually wasn't that
Okay.
unusual for a lot of people. But, also this program kind of operated like a temp staffing agency. Like,
I'm sorry. That's so crazy.
yeah,
So, an addiction treatment is recovery center is operating like a temp agency and placing their patients in sort of forced labor.
Yeah,
So we now
exactly.
know oil jobs, so Exxon and Shell. Then we know you mentioned chicken, so
Yes.
what else?
Yep.
There's got to be a third. It's always in threes,
Oh, yeah.
Shoshana.
I will tell you more. I mean, we did an entire podcast series at Reveal called American Rehab,
Ah,
focused on this type of rehab program. And we found rehab facilities sending people to work at assisted living facilities and nursing homes and hospitals, where they had very easy access to
to
medications.
patients. That's exactly what comes to mind.
Yes, and very vulnerable patients that they were
Mhm.
taking care of.
Yeah.
We found
Mm.
people working at a zoo where they were disposing of dead animals,
Oh,
um, people working on construction sites and Williams-Sonoma and Walmart warehouses. I mean, the list goes on and on. And these are people who are supposed to be receiving treatment, and instead they are being exploited as temp workers who are not actually getting paid. The rehab is collecting all of their pay.
so what do these for-profit sort of brand name, household name companies say about this?
Um, I recall that several companies denied knowledge that they were essentially employing unpaid workers.
Mm,
In some cases, uh, like in Senecor's case, oftentimes they would hire the patients out to a subcontractor who is then sending the workers to places like
right.
Exxon and Shell oil refineries. So sometimes these labor arrangements were hidden underneath
Okay.
subcontractor layers. But then other times, I, if I'm giving employers the benefit of the doubt, they may not have always been aware that the workers they were receiving were unpaid. There was for a time, Senecor was actually producing ads for its work program, calling it work therapy or vocational training. And the places where participants were working seemed really excited about this arrangement. Like they're supporting people in recovery, they're providing on-the-job training and mentorship. I don't know for sure, but I have to imagine that many of those companies were not totally aware that their workers were not seeing any financial benefits from the arrangement. And after our initial podcast series came out, in fact, a lot of employers did cancel their contracts with the Senecor Foundation. And I should say, too, that Senecor ended up closing their work program.
They did. Well, good job.
Yes.
Good for you. So
They still
they
remain in business, but yeah, supposedly
that
no longer
aspect
involved
is
in
no
work.
longer. But were they when people were signing up for recovery, did they know? Did Senecor was Senec they were telling them you will go as you will just work and not get paid for it.
It wasn't as clear cut as
Right.
that, like Chris Kuhn is one of the people that I follow in my book, and he was court ordered to
Hmm.
Senecor. And when he went, the first time he went to the facility, the day that he entered the facility, he went with his grandma and his mom, and they received this stack of paperwork. And it's like
You're just
so many
signing,
words,
signing,
like what
signing.
else can he do but sign? Because if he doesn't sign, then he's going to jail and probably prison, right? So
Yeah.
he's going to sign whatever is there. But buried in that paperwork were a lot of details that I imagine a lot of people would find really disconcerting and worrisome. Like if
Mm.
you get injured, you're not going to get workers' comp. You're going to work, but you're not technically an employee. Um, uh, Also, permission to surveil every piece of mail that comes in, the phone calls that you make. There were a lot of details in that paperwork that, he kind of
Mhm.
glossed over that if you were really thinking about, would prompt a lot of questions. And at first, Chris entered the program. The first 30 days were spent sitting in a classroom, learning the rules of the program, and there were a lot of rules. It was a behavior modification program, so
Mm-hmm.
and modeled after Synanon, which we haven't talked about yet, but we could talk
Yeah.
about at some point. But basically it's a place where people go and live and work, and Chris was told that he'd be able to save up money while he was in the program for after he left. And you live among other participants and you hold each other accountable. They would, there was a
Mm-hmm.
requirement that they have to like there's all these different terms. So he had to submit a certain number of pull-ups every week, and pull-ups are essentially slips of paper where you tattle on somebody else. And they
Oh,
had, and they had to do these regular group activities called the game, where everyone takes turns holding each person accountable, screaming at someone who may have done something wrong or who may have acted in a way that upset the other person. So that's what Chris learned in his first 30 days, like all these rules, always have a pen on you. Don't let your shirt come untucked. Um, uh, Always wear a belt, no coffee. I can't even remember the extensive list of rules. And then after those 30 days, he was sent to work. And that's when he realized, oh, I'm going to be working an incredible up to 80 hours per week in these really uh,
yeah.
difficult manual labor jobs, working, building scaffolds at chemical plants, laying asphalt in the broiling Louisiana heat, cleaning up after LSU football games.
Ooh,
Or,
no.
yeah, I
Any
know.
after any big college football game, you don't want to have to clean up,
No,
honestly.
you really don't. You really don't. Yeah, I mean, it, that's predominantly what he was doing. And there was rarely any time for counseling, rarely any time for medical care, and people were
Yeah.
constantly injured on the job in this program and did not receive adequate uh, care for their injuries. And that's what
Is
happened to Chris.
is the theory that, work will keep you busy, keep you occupied, so that's part of the process, right? In recovery, was that their theory for operating this way?
I mean, there was a financial need for the
Okay.
work.
Mm-hmm.
Um, you know, Senecor is a little bit unusual compared to some of these other similar programs because um, it does accept insurance, and it was licensed by the state.
Mm-hmm.
But typically what happens is these programs are free or incredibly low cost to enter. And so the participants are working to fund their stays. What I found, however, with Senecor is that the amount of money that the facility was bringing in through these unpaid labor arrangements was
Mm-hmm.
far more than the actual cost of operating the facility. So they were working to an extreme, and they were working to make a
Yeah.
profit for the facility. But I think in, Senecor's advertising materials, the work was described as providing people with a purpose, providing
Sure.
training to help them after they leave the program. And there were a number of people I interviewed and met who left Senecor and, they had a job as an electrician. So, you know,
That pays pretty well these days, honestly.
yeah, absolutely. So I think there's obviously huge benefit to work.
Sure.
Um, for numerous reasons, like you can support yourself. It
Yeah.
provides you with a sense of purpose. It occupies your days. Um, but oftentimes the way these work arrangements were happening at these facilities was not providing that. It was devastating people
Mm.
emotionally, mentally, and also sometimes physically.
Which just leads to relapse.
Yes, exactly. There were a lot of people who I interviewed who went to Senecor who are no longer with us now because of overdose.
Mm. Well, you write punishment can sometimes spark recovery, but also has its limits. How can treatment balance accountability with compassion, in your opinion?
Hmm.
I know it's a hard one, right? How do you get it perfect?
Hmm. I just keep coming back to um, uh, what happens after treatment
Hmm.
and um, and the importance of recovery capital. And I think that uh, if if the consequences of addiction remain with someone after they leave treatment, then relapse is almost inevitable
Mm.
because um, because it can be so difficult to overcome those obstacles, um, to overcome the consequences of addiction, even if you have the best of intentions um, and you want to be sober or you want to maintain some kind of long-term recovery. If there are barriers, if there's barrier after barrier and obstacle after obstacle, it's going to be so difficult to actually overcome. And so I think that's a really important missing element in our treatment system. People go into treatment, and even if it's a great treatment program and they get a lot out of it, once they leave treatment, if there's no plan for the long term and no plan for accruing that recovery capital, for obtaining those resources that people need to sustain recovery, then likely that treatment is going to lead to relapse. And we know from studies that someone who actually completes a 30-day treatment program is more likely to overdose and die in the year following treatment than someone who fails to complete it at all. So I think there's something really missing here. And until people are able to overcome the consequences of their addiction, it's going to be very difficult to come out of it.
Wow. Well, Shoshana, where can people follow you?
Oh,
Do you know?
I'm on all the social media
All the
sites, apps,
socials.
etc. Unfortunately, I'm on Instagram, Walt Show. I'm on LinkedIn. I'm also on Facebook, all public accounts. And I welcome tips from readers and listeners, and just all of your thoughts about addiction and recovery. I'm here for it.
Well, everyone, go get Rehab by Shoshana Walter. And thank you for coming on The Poisoning.
Thank you so much for having me. I really appreciate it.